Asthma is a condition characterized by breathlessness and wheezing. To understand how asthma causes shortness of breath, one must look at the normal respiratory system. Air enters the lungs through a large tube known as the trachea, which is supported by concentric rings of cartilage connected to each other by annular ligaments. The trachea splits into a right and left primary bronchus, and from there each primary bronchus subdivides into secondary and tertiary bronchi. Tertiary bronchi continue to branch into smaller tubes called bronchioles. Unlike the larger tubes, bronchioles do not contain cartilage and must rely on smooth muscle in their walls to keep these airways open. The smallest and final branch of bronchioles, called terminal bronchioles, end blindly into the alveolar sacs. Alveolar sacs are made up of grape-like clusters of alveoli. Within these alveoli, gas is exchanged and vital oxygen enters the bloodstream. Throughout the bronchiolar tree, mucus is secreted from specialized cells in the walls to trap foreign particles and irritants that may be in the air we breathe. The walls consist of cells that are covered with cilia, whose main role is to push mucus up and out of the bronchiolar tree, disposing of the trapped particles and irritants. Looking at a cross-section of a bronchiole, it is evident that under normal conditions, there is little resistance offered to the incoming rush of inspired air. The wall of the bronchiole is relaxed and provides an open airway. Asthma is a chronic condition in which various irritants cause bronchioles to become inflamed. Some of the most common irritants are dust mites, pollen, smoke, stress, and infections. These irritants can cause a cascade of events, such as the release of leukotrienes and histamine from leukocytes and mast cells. The result is inflammation, overproduction of mucus, and bronchial constriction. All three block the airways, making it difficult for air to move in the lungs and thus triggering an asthmatic attack. There are several treatments for asthma. The most common is epinephrine and related compounds. Epinephrine stimulates beta-adrenergic receptors in the bronchioles and promotes the dilation of bronchioles. Epinephrine can be inhaled as a spray to open up clogged bronchioles, which in turn will relieve the symptoms of an asthmatic attack.
Hello, my name is Amjad Rubai. I'm a pharmacy student at Al-Yarmouk University College, and this is my friend Today we will be guiding you through an introduction about asthma. Asthma is one of the most common chronic diseases of the childhood, affecting about 6 million children worldwide. Asthma is a chronic lung disease that can cause repeated cough, wheezing, and breathing difficulty.
During acute asthmatic attack, there is inflammation on the swallowing of the airway lining the lung. Also, there is a mucus production on the spasm of the airway that lead to decrease the airflow.
Asthma is characterized by airway inflammation. The airway lining becomes red, swollen, and narrow. Airway obstruction, the muscles encircling the airway tighten, causing the airway to narrow, making it difficult to get air in and out of the lungs. Airway hyperresponsiveness, the muscles encircling the airway respond more quickly and vigorously to small amounts of allergens and irritants.
Common signs and symptoms of an acute asthma episode include coughing, wheezing may be absent, breathlessness while walking or while at rest, respiratory rate increase, chest tightness, chest or abdominal pain, fatigue, feeling out of breath, agitation, increased pulse rate, inability to participate in sports.
During an acute asthma episode, signs and symptoms of increasing respiratory distress or breathing difficulty include inability to talk in sentences using phrases or only words, retractions, increased use of chest, neck, or abdominal muscles, refusal or lie down. A child may prefer to sit or lean forward in order to make breathing easier. It is important to remember that not everyone with asthma has the same symptoms. Asthma triggers are allergic reactions to environmental allergens such as pollens, molds, dust mites, or animal dander. Also cold and viral respiratory infections and exercise.
Also, change in weather, exposure to cold air or sudden temperature change, irritants such as tobacco, smoke, air pollutants, paints and cleaning agents, strong odors and or perfumes.
Exercise-induced bronchoconstriction, EIB. For some people, asthma symptoms may only occur during exercise. A history of a cough, shortness of breath, chest pain or tightness, wheezing or endurance problems during exercise suggests EIB. Exercise-induced bronchoconstriction is often a marker of inadequate asthma management. Typically, these individuals respond well to anti-inflammatory therapy. However, it is not an excuse for asthmatic patient for not participating in sport or exercise.
Asthma medication. Medication for asthma are characterized into two general classes. Long-term control medications to achieve and maintain control of persistent asthma. Quick relief medication treat acute symptoms and signs of exacerbation.
Long-term control medications taken daily on a long-term basis. Long-term medications achieve and maintain control for persistent asthma. The most effective long-term control medications are those that attenuate the chronic inflammatory aspect of asthma. Examples include inhaled corticosteroids, the most consistently effective long-term control medications. Long-acting bronchodilators, LABA. Those are used in combination with inhaled corticosteroids. Cromolyn and theophylline, used as alternative controller medications, they are not preferred. Leukotrienes modifiers used to alternative control medications. Immunomodulators, omalizumab, modifies the allergic immune response.
Quick relief medication taken as needed, short-acting beta-agonist, SABA, relax airway muscle to give prompt relief of symptoms. Examples include albuterol.
Asthma control. Parents of children with asthma should be taught to recognize symptoms that indicate poor asthma control and the need for additional therapy. Symptoms indicating poor control include daytime asthma symptoms, wheezing, cough, chest tightness, or shortness of breath. Waking up during the night due to asthma symptoms. Frequently using short-acting beta-agonist for relief of symptoms. Inability or difficulty performing normal activities, including exercise, because of asthma symptoms.
An asthma action plan includes: number 1, the steps to take for treating acute asthma episodes. Number 2, long-term control, medications when prescribed. Number 3, emergency numbers to call.
118 82nd Avenue. 702 is calling.
When the windpipe's closing up, we could get air. Come on, AV3.
Children with increased asthma symptoms need attention. Follow the steps prescribed by the child's health care provider in his or her asthma action plan. Here are some other useful tips. Give the child quick relief medications immediately. Quick relief medications are needed to get control of the acute asthma episode. Help the child to sit in a comfortable position. Children may lean forward to assist breathing. Talk calmly to the child. Encourage deep, slow breathing. Measure peak flow and assess symptoms before and after treatment.
Seek emergency care if any of the following are present. Number 1, the child has trouble walking and talking due to shortness of breath. Number 2, the child is struggling to breathe. Number 3, the child's fingernails or lips are turning blue. Number 4, there is no improvement in the child's symptoms within 20 to 30 minutes of taking rescue medication.
At the end, asthma is a chronic disease that cannot be cured, and all medications available nowadays are used to relieve symptoms of asthma.
Therefore, we need your help to educate people about handling acute asthma attacks until hospitalized. This will save many lives. Thank you for listening.